Some 45 million people will have to get what amounts to a prescription from a doctor in order to be reimbursed for over-the-counter medications such as cold and flu remedies or allergy medicines starting in January.
The changes are going to add unnecessary cost to the system and make it more difficult for patients to obtain the medications they currently rely on.
Those millions of Americans are getting notices that pre-tax money they set aside for flexible spending or health savings accounts can no longer be used for over-the-counter drugs unless a doctor writes it out like a prescription.
We're talking about 15,000 over-the-counter products that now are subject to this new policy.
Things such as Tylenol, remedies for stomach ailments, cold and cough medicines, allergy medications, and many others. The National Organization of Chain Drugstores is asking the federal government to at least delay the rules for 2 years.
In order to carry this out in a way that minimizes consumer confusion and that really makes it possible for healthcare providers, such as pharmacies, to implement this new policy.
One of the complications of this policy is that people will be forced to make an appointment with their doctor in order to use flex spending money for over-the-counter drugs.
There's an office visit associated with that. There's, the doctors are going to have to charge you for an office visit.
That's going to add cost at the doctor's office. It's going to take time out of my day, and it's going to make it more likely that I'm going to go without taking the medications that I need.
Not only that, but with chronic conditions such as allergies, it might be cheaper to get a prescription drug if your health plan has a reasonable copay.
So you would be inclined to go with the prescription drug that might, in the end, have a higher total cost, but you pay a lower share of that total cost.
A higher cost for the employer, but not the individual.
An incentive for me to use a higher cost prescription medication instead of using the more affordable over-the-counter medication that works just as well.
The impact will be that people will use their FSAs a lot less than they used to. That's unfortunate.